Hey there, it's Dr. Jim Collins. Thank you so much for stopping by. I appreciate your time, and this episode I'm dedicating to work-related PTSD. It's a serious problem. I have to admit, I haven't thought about this one for quite some time, but work-related stress and burnout affect numerous professionals, including firefighters, police officers, EMTs, and healthcare professionals, especially nurses who work in critical care or emergency rooms. Matter of fact, I have another video that I'm ready to shoot on that particular topic. Many professionals would undoubtedly admit that their jobs are very stressful at times. And occasionally they do feel occupational or emotional burnout. It's kind of normal depending upon what we're doing, how long we're doing it, and the intensity of our jobs. But something far worse than stress or burnout is job-related post-traumatic stress disorder, or PTSD. Work-related PTSD is a very important condition which many healthcare professionals may experience as they provide services to other individuals. Thankfully, the symptoms of PTSD for many individuals are going to be very short-lived, and people can adjust to them, deal with them, get therapy, and have these issues resolved within weeks and sometimes months. And of course, what we don't want to see our healthcare professionals or any other firefighters and police dealing with long-term chronic PTSD, because it can be very debilitating and devastating. So a lot of research has actually been written about stress reactions for centuries, and a good deal of this work has been done with the military. For instance, even dating back to the Civil War, World War I, World War II. I'm sure you have heard of terms like battlefield fatigue and shell shock. Those terms essentially mean post-traumatic stress disorder, but it wasn't until 1980 that the term post-traumatic stress disorder became a part of psychiatric lingo or vernacular, and it was years after Vietnam when our troops were coming back with very specific symptoms and conditions, nightmares, avoidance, extreme anxiety and panic, things like that, that the diagnosis post-traumatic stress disorder was actually fully accepted. So more women than men in the United States experience post-traumatic stress disorder. There is a prevalence of 10% for women and half of that, 5%, for men. And what that means, it means a lot of different things, but in general, what I pull out of that is women may possibly be more vulnerable to severe traumatic experiences, 9/11, terrorism, a mass shooting, whatever the case is. And the risk of developing post-traumatic stress disorder really does depend on a lot of factors, like the nature of the event, your individual personality, life history, the events that take place after the traumatic incident is over. Another very important factor associated with PTSD, developing or not, is having good social support. People with healthy social networks that provide emotional support seem to do much better with post-traumatic stress disorder. Additionally, pre-existing conditions like depression, anxiety, substance abuse will make a significant difference in whether an individual develops fully symptoms of PTSD or if they adjust to the symptoms of PTSD and move on. So thank you. My time is up. I appreciate you hanging out with me. I really do. And I'm always working hard to come up with good, interesting topics. I hope some of these help you personally, help your friends, relatives, or family. So until next time, my name's Dr. Jim. Take good care of yourself.